If you're having neck or back issues, you want to go to the best doctor. Today we're at the office of Dr. Jason Cuellar to learn all about his treatments. Hey, Dr. Jason, nice to meet you. I'm Daryl.
Great to meet you.
I am having a couple spine issues, and I hear you are the man that I need to see to take care of that. Now, I know you are a spinal recovery patient yourself. Is that what inspired you to open up your office?
Actually, it is. I was only 20 years old. I was moving furniture and unfortunately herniated my L5S1 disc. And I had terrible sciatic pain. And at that point, I was about to start a PhD program at UC Davis, and I started reading the literature and medical textbooks trying to understand why this herniation was causing me so much pain. And I came to find out that no one really knew the exact mechanisms. So I studied the mechanisms of disc herniation-induced nerve pain for my PhD thesis. And at the same time, I had surgery, and I had a good recovery, a good result. So that really inspired me to become a spine surgeon. So I trained as an orthopedic surgeon, and I did my fellowship in spinal surgery. So I mostly do spine surgery, but I also do treat knee, hip, and shoulder arthritis with A2M injections. But for spinal problems, it depends on what the problem is. So if you have a herniated disc or degenerative disc causing you neck pain or back pain or shooting pain and numbness tingling in your arms or legs, my preferred treatment would be a disc replacement. You've heard of knee replacements or hip replacements for osteoarthritis.
Yeah.
Well, I try not to fuse the spine anymore. They stopped doing fusions of knees and hips like 50 years ago. So
yeah.
Why are we still doing spinal fusions, right? So there are some situations where I have to do it, like if the spine is unstable, but in general, I try to use motion preservation techniques. This is the hot thing in Europe called the M6, and we just got approval here this month to use it in the US. And our site here, Dr. Landman and I, will be the first ones in Southern California to be able to use it.
And why is this one so popular?
Well, if you feel it, it has a compressible core.
Oh yeah, I can push that right down.
Yeah, you can compress it a little bit, which is like the disc that you were born with. It has a little bit of compressibility. My wife also sees patients here. She is an orthopedic surgeon that specializes in hand and wrist procedures, and she has an aspect of her practice called whole body health and well-being, where she analyzes patients with various complaints and looks for nutritional deficiencies, and then she can treat them with various supplements or changes in their diet. So we really take a team approach here.
So when a patient comes to see you, they not only get you, but they get your full team, right?
That's right.
Great to meet you.
Great to meet you, Darren.
Don't let spine pain stop you from living your best life. Make an appointment with Dr. Jason Cuellar, and he will get you right.